It is not a disease, rather a symptom that represents a primary form of brain dysfunction. It is characterized by paroxysmal excessive neuronal brain activity and an abrupt onset of motor, sensory, or psychic symptoms. Hello, everyone. Welcome to the series on medical emergencies in dental practice. Today, I will be discussing about seizures. So, starting with different types of seizure, it can be classified as partial seizure, tonic clonic seizure, absence seizure, and status epilepticus. Partial seizure begins in a localized area of the brain with clinical signs and symptoms correlating to the affected area. It can be subdivided as simple partial seizure that involves a small portion or a focal area of the brain without impairing awareness, and complex partial seizure characterized by extensive cortical involvement, impairment of consciousness, and complex behavior patterns called automatisms. Next, coming to generalized tonic-clonic seizure that rapidly involves bilateral, cortical, subcortical, and brainstem networks of the brain. It can be divided into four phases: prodromal phase, pre-ictal phase, ictal phase, and post-ictal phase. In the prodromal phase, there are subtle to obvious changes in emotional reactivity, including increase in anxiety or depression. It is characterized by an aura that lasts only a few seconds. The aura is not a warning sign but an actual part of the seizure. It relates to the specific region of the brain where seizure originates, such as olfactory, visual, gustatory, or auditory. In the preictal phase, there is loss of consciousness, and if the patient is standing, he or she may fall on the floor. Simultaneously, series of generalized bilateral major myoclonic jerks occur and last for several seconds. Also, there will be epileptic cry and autonomic changes such as increased heart rate and blood pressure, increased bladder pressure, cutaneous vascular congestion and piloerection, glandular hypersecretion, superior ocular deviation with mydriasis and apnea. The epileptic cry is produced as air is expelled through a partially closed glottis while the diaphragmatic muscles go into spasm. The ictal phase is characterized by a tonic component that lasts for 10 to 20 seconds and a clonic component that lasts for 2 to 5 minutes. In the tonic phase, a series of sustained generalized skeletal muscle contractions occur, first in flexion, which then progress to a tonic extensor rigidity of the extremities and trunk. On the other hand, the clonic phase consists of generalized clonic movements of the body accompanied by heavy stertorous breathing, alternating muscular relaxation, and violent flexor contractions. During this phase, the patient may froth at the mouth due to mixing of air and saliva. Also, blood may appear in the mouth as the patient may bite the lateral border of the tongue or cheek. The ictal phase ends as respiratory movements return to normal and tonic-clonic movements cease. This is followed by the post-ictal phase where there is regain of consciousness. The clinical manifestations largely depend on the severity of the ictal phase. There is momentary period of muscular flaccidity during which urinary or fecal incontinence may occur. Patient relaxes and sleeps deeply and exhibits almost total amnesia of the ictal and post-ictal phase. Full recovery to the pre-seizure cerebral functioning takes approximately 2 hours. Coming to absence seizure, it is manifested by sudden immobility and a blank stare. It lasts for 5 to 30 seconds and the individual may exhibit simple automatisms and minor facial clonic movements such as cyclic blinking of the eyelids. Status epilepticus is a true medical emergency that can be defined as a seizure that continues for more than 5 minutes or a repeated seizure of any type without recovery between the attacks. It is usually categorized as generalized or partial and convulsive or non-convulsive. Now coming to the management part, absence and partial seizures involve protective management where the rescuer acts to protect the patient from injury, terminate all dental procedures, Reassure and speak with the patient to determine the level of alertness and ascertain the cause. If the seizure was related to dental phobia, stress reduction protocols should be used for all future appointments. Consult the patient's primary care physician or refer the patient for medical advice. Do not allow the patient to operate any motor vehicle and do not discharge the patient without attendant. If the seizure persists for long, such as more than 5 minutes, start basic life support and call for medical emergency services. The objective in the management of tonic clonic seizure is to prevent injury and maintain adequate ventilation. Terminate all dental procedures. If the patient is not seated in the dental chair, place the patient gently on the floor and turn onto one side. Otherwise, leave the patient in the dental chair and position the dental chair supine. The head of the patient must be protected from traumatic injury by placing something soft or flat under the head. One member of the office emergency team should move nearby objects away from the patient, while other two members should stand by the patient to minimize any risk of injury. Remove eyeglasses and loosen ties or anything around the neck that may make it hard to breathe. Now, after the seizure subsides, if the patient is conscious, let the patient remain in supine position with legs slightly elevated. Suction airway if necessary and administer oxygen via face mask or nasal cannula. Monitor vital signs every 5 minutes. Reassure the patient and observe for 1 hour in the dental office. The patient should be escorted to home and not allowed to leave unattended. However, if the patient becomes unconscious after seizure, call medical emergency services. Place the patient onto one side and suction airway. Administer oxygen and monitor vital signs. Start basic life support as needed and shift the patient to an emergency care facility. In case of status epilepticus, terminate all dental procedures and activate medical emergency services. Position the patient gently onto one side and monitor vital signs every 5 minutes. Administer supplemental oxygen and obtain vascular access. Check random blood glucose levels and administer 50% dextrose if hypoglycemia is present. If thiamine deficiency is a possibility, thiamine should be given before dextrose. Anticonvulsant drugs may be necessary to terminate the seizure. Among the anticonvulsants, lorazepam is preferred because of its rapid onset of action. The recommended dose is 0.1 mg per kg IV and not more than 2 mg per minute. If lorazepam is not available, diazepam can be used at 0.15 mg per kg IV up to a maximum of 5 mg per minute. A repeat dose can be administered after 3 to 5 minutes if seizures do not resolve following the first dose. In pediatric patients, intranasal midazolam given using 1 ml needleless syringe with an aerosolizing head has been effective. If the second dose of lorazepam or diazepam does not abort the seizure, then it should be treated as refractory status epilepticus with continuous infusion of anti-epileptic drugs such as midazolam or phenytoin. Post-recovery, place the patient onto one side and suction airway. Monitor vital signs and transport to an emergency care facility for further evaluation. At the end, let's recap the do's and don'ts in seizure. Keep other people out, clear dangerous objects, time the seizure, cushion the person's head, roll the person onto one side, stay and reassure, call for medical help, observe as the person regains consciousness, do not panic, do not restrain the movements, and do not put anything in the person's mouth. So, that was all about seizures. However, it is recommended to refer the updated and standard guidelines regularly to keep yourself up to date with the emergency protocols. In the upcoming video, I will take on another medical emergency and its management. Till then, if you found the video helpful and informative, then do like the video, share it with your friends and subscribe the channel for more such contents. Also, you can download our app for more details and notes on dental and medical topics.